Dr. Mark Diaz came here from Sacramento, from California. So when you think of kind of people who have made a path for our Hispanic Latino community, Dr. Diaz is like the person here in the US. He really has, I mean, I was telling him last night, you know, Clínica Tepati is a student-run clinic at Davis, and it's been, I mean, I've been hearing about it since undergrad, and through med school and after in residency, and he was one of the founders of Clínica Tepati, and he was also one of the beginning founders of the National Hispanic Medical Association. He was a founding member of the National Hispanic Medical Association. So here we are, the Nevada NHMA chapter. And thank you to you for founding it, because otherwise we wouldn't be here. And he's also the chairman and the board of director of the NHF, which is the National Hispanic Health Foundation. So over the last, I don't know, Dr. Diaz, how many years since you were at UCSF for undergrad or for med school? What year did you graduate?
79.
Since 79 to now, he has been making a monumental impact on Hispanic health in the US. And so he has joined us today, and we're so grateful to have him. So thank you for coming to Reno, Dr. Diaz.
Thank you very much for that kind introduction. I think you could say that the impact started actually at Clínica. Oops, which one? Okay. It started in 1974. We just had our 50th annual banquet for the clinic, and so yes, there have been many students, undergraduate students like myself. One of my fellow undergrad students at that time was Dr. Faustina Nevares, who later went on to serve 15 years on the board of directors for Kaiser Permanente South, which is a pretty big organization. And she came from a small rural town in California called Arbuckle. You probably never heard of it, off of I-5. And so the student-run clinics have been important, and I'll mention that right now when I talk about the medical school application process for those of you who may at some point do that. And also as a reminder to those who maybe haven't experienced that process in the United States. If you're from another country, of course, you would have gone through a different pathway. So I'll just go ahead and get into it. And first I'll start off with a little bit of history. Let me get this. So you may not know that the first medical school in the Americas was not, as you see at the bottom, University of Pennsylvania in 1765, but rather it was a proclamation in April 30th of 1547, and the establishing La Real y Pontificia Universidad de Mexico in Mexico City, where medical examinations began in 1553, with the chair of medicine established in January 7th of 1579. Okay, so if you do the math, it's more than almost 200 years before the United States figured out how to have a medical school. And also another one of the first schools in the Americas was, as you can see, Universidad de San Marcos in Lima, Peru, which was founded in 1634. Now, besides being a historical point, I mention that because of this whole idea of imposter syndrome. And I wondered about why I made this slide. And part of the reason why I made this slide when I first put this together a while back ago was to give some perspective to our Latino students. So imposter phenomenon is, I feel I do not belong here. Students experience pervasive feelings of self-doubt, anxiety, depression, and/or apprehension about being exposed as a fraud in their work, despite verifiable and objective evidence of their successfulness. So our first generation students typically have immigrant parents who came to the US without knowing how to speak English. How many, well, I don't know if the students are still up, but how many of you students had that, right? Your parents didn't speak English when they came here. Well, guess what? They didn't speak English, but they found jobs. And they worked hard to give their children opportunities of a better life. So these parents, okay, because I'm speculating, and anybody can correct me if I'm wrong, but I think it's highly likely that they're intelligent and they're leaders in their community. Maybe they're not, on a school board or something, but they may be active in their church, or they may be involved in sports activities or something. So they're leaders and they're intelligent. And following that logic, you figure their kids are not dummies. Any of the students object to that idea? Right? Okay. And these people that came from another country, didn't speak the language, maybe he came from a small village in Ecuador or a small village in Mexico, and their kids went to a college or university, some of them to very prestigious universities. How does that happen? Is that on accident? Of course not. And so I think that it's important to have the proper perspective. Some of the students were mentioning, oh yeah, look at my peers and I didn't have the advantages that they had. Well, yeah, maybe you didn't have their advantages, but you did have your advantages. And your advantages were your parents. So now I'm just going to talk a little bit about the application process and where you would get information from the AAMC. And I recommend that students go to that website and read the entire thing. There's a lot of important information there. There's also a website for osteopathic medicine. And then there's foreign medical schools like UAG, ELAM, Escuela Latinoamericana de Medicina in Cuba, and Ross University and other Caribbean schools. I'm not recommending them necessarily because I think you can go to school here in the US, but some students choose to go there for a variety of reasons. The AMCAS application looks at a number of things: demographics, like where you grew up and your parents' educational level. First-gen students get a break at some of the schools. I know at UC Davis, there's what's called a distance travel score, and that number is created by your parents' educational level, family income, and other social factors. On the application, there's also an impactful experience statement, which previously was called the disadvantage statement. So you get to talk about things that have impacted you. And if, there's certain negative things that can interfere with your studies, you should mention those. The primary childhood residence, I mentioned the family income, and the funding of post-secondary education, which interestingly enough, there's some people that, there's a part where it asks you for your income, family income. And I see applications in which people who are like in their 20s don't take the time to go ask their parents, how much money do you make? So they put no answer or refuse to answer. And I find that kind of disingenuous. Okay, no matter whatever is written down there, it doesn't really impact me as far as looking at an application. But I just feel kind of strange when somebody doesn't answer the question, because then I feel like they're trying to hide something. What for? I don't know. I would feel much better about them if they were transparent. Economic disadvantages, as I said, will come out on there: low-income parents, single-parent household, poor educational opportunities, and working during school. These are all things that can be mentioned in that impactful statement. Social disadvantage, a broken home, having to care for family members, like elderly family members or people with illness. Somebody mentioned a family member with breast cancer. Also, students, may mention that they were victims of some kind of abuse in their family or otherwise. And then significant mental or physical disabilities like students who are in a wheelchair or something like that. All those things can impact your educational experience, and it's helpful that if you explain that. Things that are also judged in that distance travel score are the parent's educational level, school administrative actions, criminal record, military record. We also look, you also have to mention if you had a previous application. I don't see that as being a big deal. Some of the schools will only allow you to apply maximum 2 times. I think USC, University of Southern California, is like that. So it just flat out says on their website, you can apply twice and that's it. Don't apply again. Also, things that are important is whether you have worked, like provided service in an underserved area or to underserved populations, because you could be in a city and it's underserved population, and understanding the problems faced by underserved populations, because you might get asked about those in an interview situation. Then your transcripts, that's pretty obvious that that's going to be looked at, and your grades and science classes, biology, chemistry, physics, and math, that's your BCPM grades. And if those are upward trending, or if you've gone to a post-bac program and shown strength in those classes, that's important. So your MCAT scores, the chemical, these are the 4 categories. And what's always puzzled me is that the majority of Latino students, and also other students who have English as a second language, they'll do well in the first 3 that are listed there, and they won't do as well in the critical analysis and reasoning skills, which kind of boggles the mind, because, well, how can they do all this other stuff and then they can't think? It doesn't make any sense to me. So I think that this kind of evidence of some implicit bias in the way the test is structured that depends on your mastery of the English language, and doesn't really relate well to what you're going to learn in medicine. Now, this is a very interesting image from, again, the AAMC. And I'm not sure if you can see from over there, but one of the first places that I point to students, is on the top right-hand corner. I don't have a pointer there, but these are students who have greater than a 3.79 GPA and an MCAT score of greater than 517. So I think everybody would agree that that's a pretty top student, right? Any disagreement there? Okay. And if you look at that, the acceptance rate for those people is, we'll call it 83%, okay? But the take-home message that I have for you as students, before you get discouraged and say, oh my God, I don't have a 3.79 GPA, is that 13% of those students, okay, more than 1 out of 10, guess what? They didn't get accepted to medical school, right? So what's going on there? And then you can look at the left-hand side and go down to somebody who's, I don't know, either really lucky or whatever. This person with a 2.2 and MCAT score in the 486 to 489. That person who actually was 1 out of 100. And the take-home messages there is, if that one person out of 100 had not applied to medical school, they wouldn't be a doctor, right? So somewhere, you may fit somewhere in between those 2 points. But you shouldn't lose hope if you're not in that 83% of the people that are way up there at the top right corner. Because there's people in between that get accepted to medical school, and what's the difference? That's what I said at the beginning, that there's more to it besides just the grades and MCAT scores. They're important, there's no doubt about that, but it's not the only thing. So what are the other things? Well, activities, medically related clinical work, like working as an EMT or a paramedic, Scribing is really popular now. Medically related or other scientific research, leadership skills, tutoring, especially if it's science related, and teaching, community activities, for example, feeding the homeless. I think somebody mentioned food as medicine. Well, obviously, if the homeless aren't eating and you feed them, it's going to make them healthier. Social activities, being a part of a sorority or fraternity, family activities, caring for an elderly grandparent, as I mentioned before, and then the total time spent on those activities. I mean, if you spend, 20 hours in observership, it's way different than spending 1,000 hours working as an EMT. So there's a difference in terms of the activity if you're actively part of the healthcare team. So I recommend that if you're going to choose things to do, pick ones where you're going to be part of the team, whether it's an interpreter, a scribe, a paramedic, front office worker in a medical clinic, something where you're part of the team. And leadership skills are things that you can get from being in an elected office at your school, putting projects together, students that start different organizations, sports leadership or church leadership or dorm leadership, or being involved in the leadership of your fraternity or sorority. Then I almost forgot this one, but this morning I thought it's like letters of recommendation. How do you get those? Well, probably a good idea to attend office hours for the professor to know you, or, if you're working in a clinic, the doctors there are going to know you, or whoever's managing the clinic is going to know you. You need to identify potential letter writers, of course, express your interest in medicine. And if you don't do those things, I did not attend office hours. I hate to say that because I was a first gen and I didn't know I should do that. And so I thought, wow, how am I going to get a letter of recommendation from a professor that barely knows me, just maybe because I sat in their class? And so what I did back then in the last century, like I said, was to prepare an autobiography because, hey, that's my life story. And so I provided my professors that I thought might write me a decent letter with an autobiography and my college transcript, which was not that great. But for full transparency, that's what I did. And I guess they must have written decent letters because I did get accepted to medical school. So that's just my suggestion. If you are not that close to your professors, you haven't gone out to coffee with them, you haven't gone out to dinner with them, hey, that's another way to do it. And they are important, by the way. We do review letters of recommendation. I'm sure UNR does that. And certainly at UC Davis, we do. And the personal statement, here's another piece where you can have the opportunity to directly address the admissions committee, where you can describe your background or what was your undergraduate educational experience, especially if you need to explain a weakness and how you overcame it. What was your exposure to medicine? One of the things that I recommend too is to provide a memorable image. And one of the ones that I remember in reviewing an application, this was quite a while ago, was a young lady who had volunteered for the Peace Corps. She went to Africa on her assignment, and on the way to the place where she was supposed to teach, because that was a teaching thing, there she was in a motorcycle accident, and she lost her leg. So they sent her back to the US and she went to rehab. And then I often ask people that I tell that story is, what do you think she did next? And some people say, well, she applied to medical school. No, she didn't. So what she did was she went back to Africa, she did her Peace Corps application, and then she applied to medical school. We didn't even discuss that lady. It was like a total agreement. We want this lady at our school. I don't know if she came, but she definitely made an impression on everybody. And that's what I call a memorable image. That's something that's going to stick in the minds of people who read your application. And then one other thing you can include on your personal statement is plans after medical school. Like, I'm going to go work in an FQHC or whatever you plan on doing. I want to be a neurosurgeon. You're not signing a contract. It's like, but do you have a plan? I think it's more believable if you have some kind of a plan. That's more than just generic, like, I want to help people. One thing that I always stress on the personal statement is to be positive. Avoid negative comments. I've seen some in which the student talks about, oh, I had a bad experience with doctors. They were this and that, the other thing. Well, if you're making negative comments about, surgeons, for example, maybe the person that's going to review your application is a surgeon. Why do you want to, rub them the wrong way? There's ways of saying things that are positive, and there's ways of saying things that are negative. So you want to try and keep them on the positive. You can discuss your passions with examples rather than say, I'm passionate about this, I'm passionate about that. Hey, give an example. Discuss events or persons who have influenced your choice of a medical career. And then what experiences have been a turning point in your life and what do they mean to you? And certainly have others review the statement. I don't mean just medical students, but maybe some professors, or if you have the opportunity, maybe somebody like Tamara can review your statement. I don't know if she can do that, but you want people to perhaps have some experience in this area. And this I adopted from a article that I read regarding applying to business school. But it's still valid. It's like, respect the word and space limit. In other words, follow instructions. Write about worthiness as a candidate, noteworthy activities, especially if in a leadership role. Don't repeat what's in the rest of the application, but it's okay to accentuate some of the stuff. Reveal a greater dimension. Write about past accomplishments and what they demonstrate about your values. And then discuss a critical experience in medicine that you experienced or witnessed. Then the interviews. There's really two types of interviews. A standard interview with maybe a student or faculty, or a group interview. And for that, there's sample questions that are available online. I understand that they're available on Reddit. so you can look at that. I didn't have Reddit back then, but I talked to other students who have been interviewed. And then there's the MMI, or multiple mini interview, which was developed in Canada and has been shown to be more reliable in correlating to future performance. In the MMIs, there's interview stations, and you go from station to station, and they give you a prompt, and the questions are about ethics, professionalism, interpersonal relationships, ability to manage things, communicate, collaborate, and perform tasks. And typically there's about 8 stations. So again, activities are kind of important because you learn how to deal with people, you learn how to deal with the unexpected, and certainly your questions in a MMI interview are going to be unexpected because you won't know what they are. So you can think on your feet as you learn from your clinical experiences. You're going to do better on those tests or those interviews. And then if you have to reapply, you shouldn't submit the exact same application. It's like, if it didn't work the first time, why repeat it? And of course, you can update your MCAT if it's low, get new letters of recommendation if they're more than 2 years old, and write an updated personal statement, do more medically related clinical activities, more medically related research. And I think one of the things that you think about is, especially if your transcript is somewhat challenged, it's like, well, why would they not accept you? Well, because your grades are low. Well, how do you counteract that? You don't have time to retake your whole college career, but if you're involved in clinical research or clinical activities, and those professors or those doctors write that you know what you're doing and that you're responsible and things like that, that can help to convince an admissions committee that you do have what it takes. And you want to try taking avoid taking a year off. And by that, I mean, you don't want to just say, go work at Burger King for a year. If you take time off, you want to choose activities that are related to medicine or academic research. Those are the ones that are going to help you the most on an application, because it shows your commitment to the healthcare professions, whether it's medicine or others like dentistry or pharmacy or whatever. So people have looked at what happens after medical school, and this is again addressed to the issue of the, MCAT scores and that. And basically the data suggested that regardless of performance during the college or basic science years, students who perform competently during their clinical years are likely to continue exhibiting competent performance during internship and beyond that. And so demographic factors such as age, race, gender, marital status, and presence of children played no role in intern ratings received by program directors. So they looked at, or got information from program directors in a variety of specialties, and found that the way that the students had done in their clinical years correlated the best with how they did in their internship programs. And that's pretty much it. I don't know if people have any questions or.
So going back to the experiences, and I guess you can answer this, and I know Tamara's in the room, which if you guys don't know who she is, introduce yourself. How important or how much weight does future experiences have in an application? So say you're picking up more clinical experience for the oncoming year, but you've already submitted your application.
Well, I think it's real important to read the application, okay? And if you read it, what it says is experience. So experience is past, it's not future. So if you, say, oh, I'm going to do 1,000 hours in X, and you only have 10 hours at the time of your application, you're going to be judged on the 10 hours because people can, say they're going to do anything. So the answer to your question is, when you turn in the application, it's whatever you put on there at that time, rather than what your future is. Now, perhaps at the point of an interview, then they might ask you, what are you doing now? And you could say, well, I spent the last 4 months working on a research project at UNR or something like that. Now that would help you. But in terms of the application itself, it kind of stops at the time that you submit. Would you agree, Tom?
Yeah, I think the only thing I might add to that, Angel, is that you do have an opportunity to submit updates at many schools, maybe not all. So if the school gives you that opportunity, say you were one of those, got my application in as soon as MCAS opened, and then you've spent the last 4 or 5 months working in a clinical environment, doing a research project, then go ahead and put together a PDF. You can upload that to the portal. At UNR, it's a pretty simple process. And as long as you're not applying early decision and getting reviewed, you'll know that you'll be reviewed in November, December, January. And so if you can get it in before that, then we actually, for our reviewers, have a prompt as they're reviewing your application that reminds them to go check for updates, because it doesn't appear in like the full thing that they receive. And so what that is going to do for you is show that you have been continuing to prepare. The second part of that that's really important is remember that only 1 in 4 students are going to get admitted at UNR, and it may be less or more at other schools. It's not because more students wouldn't be great doctors or great medical students, but it's a space limitation. We have 70 seats. And so what I always remind individuals to do is, yes, submit the best application you can when you do, but it's important to continue your preparation for medical school, academically, personally, professionally. Keep growing, keep spending time. So then if you get that disappointing letter that you weren't admitted, you don't immediately just say, well, my life is over. And you'll still go through the grieving process, but as soon as you get past the anger and denial and get to that resolution, then if you have continued to be engaged in these things, then you're going to be even better positioned when you put together that new application to talk about how you have continued to develop over the last year since you previously applied. What sometimes happens is someone submits an application, they just kind of sit back and go, okay, let's see what happens. And then when they don't get in, I sit down and do feedback and I say, so tell me what you've been up to. And they were like, well, I just kind of took a break because I was tired, and that's understandable. But then my advice is usually, okay, it's time to regroup. And no, do not reapply this year, but spend the next year working on those things so that when you do apply, your application demonstrates that you are even more ready for what's ahead of you as a medical student.
Go ahead.
Thank you. Hi, my name is Joe Greer. The other thing I would advise you is a lot of medical schools have rolling applications. So if you don't apply early, no matter how good you are, you might not be into that class, or you might be put on a waiting list. Because we can only take so many students, generally we take up to 2 times the number of positions we have, because students go elsewhere. But nonetheless, if you come in with a 4.0 and a perfect MCAS, and you apply late, guess what? The slots are taken. So just remember that as the process works.
Thank you.
And for those applying to UNR, we do not use rolling admission. And so while it is important, especially if you're applying to multiple schools, be aware of what the schools are looking for, because you can use that to your advantage. If you know we're not using rolling, then maybe instead of getting it in June, you spend a little bit more time in July really sharpening that application, turn it in early August. You're still well on track, because we're not going to identify the order that we're reviewing applications until we receive all of our applications. And so it does work differently at various schools. And so it's important to do your homework and know how to be strategic, because maybe you'll focus on those schools that are rolling admissions, getting those in sooner, but maybe you're looking in Nevada because it's more affordable as an in-state resident. And then instead of, prioritizing UNR, you instead say, I'm going to take July and take just a little bit more time, get my application in. I know their secondary essays are posted, so I'm going to start working on those before I even get the invitation to write them. So I don't just have 1 week to finish them, or 2 weeks. It's 2 weeks this year, prior 1 week. But instead now I can really do everything that I can to be best ready for maybe my hometown school, but maybe you've put in your applications to those rolling admissions earlier. So yeah, being strategic about this. I know it's sometimes the last thing you're thinking about because you've got so much to do, but really want to stress that.
Yeah, I think the point about the secondaries is also important to realize that, okay, you may have turned your application in on June 1st, but then you kind of lollygag and you don't do your secondaries. You get your secondaries and you don't do them right away. Some schools don't have a deadline for doing the secondaries. Your application packet is not complete until you do your secondaries. So it behooves you to do them quickly. And as she said, perhaps prepare ahead of time, because you may know the questions again from Reddit that are going to be on on the secondary. Have those ready to go, and that way you can turn in your secondaries right away, and you may jump ahead of somebody who turned the application in early, but then didn't turn in their secondaries right away. So that's another trick. And then in terms of rolling admissions, there's some schools that are kind of slow. I hate to tell on UC Davis, but I review applications up until January of last year. So their applications were not complete until they got reviewed. And I mean, through no fault of the student, but they got reviewed in January and they got interviews in February and March. And some of those people got accepted to medical school. In fact, one of the students that I reviewed one year, she was not even in the last group that I reviewed. They told me, oh, you're all done. And then 2 weeks later, say, oh, we have like 15 more students that need to be reviewed. Can you do it? I go, okay. Her packet was in there. And so she got an interview and she's now a professor at UC Davis in the Department of Psychiatry. So it is possible to get in at the very end of the picture, but I agree with Dr. Greer that I wouldn't use that as a plan. I mean, the plan would be to apply early, but not to give up, even if for whatever reason you didn't get your act together until the last minute. This year, I had 2 students that I was mentoring that turned their applications in on October 14th, with the deadline being October 15th. There's no, what can I say? I don't know what took them so long to do that. And that reminded one other thing that one of the students did is she did not take the preview exam. And so again, if you go to the AMCAS website, you'll find out about what the preview exam is. And some schools will not consider you unless you've taken that preview exam. And it's kind of like a psychological test. I never took that thing. There's the Casper, it's a similar type idea to assess whether you're psychologically ready for medical school, something like that. So you want to factor that into the equation. Don't leave it to the end. It's not something that you generally can prepare for anyway. So don't leave that one out unless you want to be nixed from some of the schools that you might be interested in. And the other thing that was mentioned about in-state tuition, some of the states there are places where they will basically waive your tuition for like a semester. And then in that semester, you're able to establish your a residency in that state. I think University of Chicago, University of Illinois in Chicago does that. In California, you have to be a resident for a year. I was talking to a student today who has a sister that lives in Sacramento. I said, look, if you're there for a year, you're going to be a California resident. You're going to pay in-state tuition, not out-of-state tuition. So that's another piece that you can deal with on your gap year, if you will, or gap 2 years, depending on where you want to apply to medical school. Any other questions or comments? Go ahead.
My name's Juan. I'm currently applying to medical school. My question would just be, how heavily weighted is academic research in the application? I know from doctors that I've talked to, like they, back when they applied, they didn't have any like academic research, and they still got in. But as I'm hearing now, it sounds like it's a lot like kind of like a soft requirement, like how clinical hours are. So I just wanted to know if like it'd be recommended to apply without academic research.
Well, I think you can do that. I don't want you to get the wrong impression, because I think admissions committees recognize that not everybody can do that kind of research. Just because of the opportunities that are available at their college. For example, at the California State College system, it's a lot tougher for those students to get involved in some kind of academic research, much less medical research. So that really isn't the issue. What I like to explain is this: who's going to make the decision? I don't think Tamara makes the decision, right?
Have an admissions committee.
Yeah, and who is on the admissions committee? Well, there's PhDs, right? There's MDs, some of whom do clinical work, some of them who do research, and there may be students, and there may be, in some schools, community people. So you're not necessarily going to appeal to all of them. Certainly, if there's a researcher on there and he sees that you've done research, in medicine, well, he or she is gonna think, es uno de los míos, right? So in that sense, sure, it's gonna help you, but I don't think it's gonna hurt you necessarily, because that same researcher is gonna realize not everybody is going to do research, right? So, and the same with, with clinical experience, maybe somebody spent a lot of time in the lab, doing bench research. Well, somebody who does clinical research isn't necessarily gonna think poorly of that person because they were in the lab all the time, right? So there's a lot of variety, but I think, if I was starting out to plan my college career to apply to medical school, well, I look at all those things. I thought back on it and on my own career, and I realized, oh my God, I did research when I was an undergraduate, and I didn't even remember that. And of course, I put it on my application, and it was a summer. It was a summer project that I got on accident because one of our family friends worked for the Department of EDD. It's the Employment Development Department in California. And so he would give us these summer jobs. Oh, he went to work for the state fair one time. And then this one summer he says, oh, there's a job at UC Davis in the lab. You want to do it? Oh, sure. Okay. So I went and I did it. And then years later, I realized, holy cow, I actually had research on my application. I didn't even think of that. So yeah, sometimes you just don't know what's going to help. Other questions? Oh, go ahead.
Question, if a candidate for med school gets interviewed, I guess back in my days, it was a face-to-face and you travel and hotels and taxis, but now I guess they do it by Zoom. Is that because of COVID, or is that just modern technology, or what happened?
I can answer that. I'm a medical school dean. And yes, that started because of COVID. But there was a wonderful article by Holly Humphrey from the Macy Foundation, which was entitled "The Social Determinants of Medical Education." And that means that there's a lot of students that cannot afford to fly around and do interviews. And this is just not pre-med. This happens to a lot of students on scholarships that go to medical school. And the example that she gave was a student that graduated top of this class at the University of Chicago, got interviews at Stanford, UCSF, all these different places on the coast, but had no money to fly there for an interview. So they couldn't even go there for their residency. So what Zoom does is it equalizes the field. It's not as good as an in-person interview, I'm telling you right now, but it equalizes the field if we really want to have diversity in medicine. And we need diversity in medicine, not because it's woke. It's because without diversity, we don't have improved health outcomes. And we've already proven that. By the way, just for pure transparency, I'm one of 4 Cuban Democrats. On 8th Street, it's really quiet. But it becomes important that we look at these things. And as you guys are, like I was, I mean, listen, there wasn't a whole lot of Pedro Jose's applying to med school back in the 70s, okay? And the idea is, just as Dr. Diaz was saying, be honest, take the high road. We can be the change agents that's changed healthcare in this country, not just for Hispanics, but for all immigrant groups that come in, and all of them. So always take the high road and look for what is right and what you need to do. And if you hang around, I'll talk about the same crap later. So I'm a gastroenterologist, so we use that term usually.
Yeah, I'll just thank you very much, Dr. Green. Go ahead.
So I actually have a question, because this is new since I applied many a year ago to medical school, but how are they doing MMIs in person still, or do they do them?
MMI would be in person.
So they're still.
The schools that do it, not all schools.
Okay.
And some schools are doing MMIs on Zoom now. We did
Right.
last year. And so it requires a little bit more technology to move people. But rather than face-to-face, they would record responses to a question. And then individuals are trained to use a rubric to assess the competencies that they demonstrate through their response. And then that gives us additional information about things like being compassionate, about being a problem solver, about, the various competencies that individual schools are looking for that align with their mission, cultural competence, that type of thing. So they have found some ways to do that.
Profession.
Yeah.
It's called virtues.
Now, just, you just reminded me of something that, and it's a baseball story about a Latin American player who was interviewed. This is early on when Latin American players were a novelty in Major League Baseball. And so they asked, the interviewer asked him, well, how's baseball in the United States been for you? And he answered, baseball has been very, very good for me. And I remember that comment so well. And it applies to medicine too, because as Dr. Greer mentioned, you have a wonderful opportunity, not just to, relate to our own culture, but to meet people from many, many cultures. In medicine, I've met people from India, from Kashmir, from Sri Lanka, China, Korea, Pakistan, and each of them have their individual cultures. They're different. My across the street neighbor was one of the founding doctors of the Shifa Clinic in Sacramento. We just happen to be neighbors now. And so I've learned a lot about Kashmiri food. By the way, it's very spicy. And so take that opportunity. You don't have to travel necessarily. You can go around the world just with the patients that you see. I've worked with Ukrainian patients, Russian patients. Afghani patients are a big part of our immigrant clinic that we have. We have a clinic where we do the immigration physicals in a small town called Knights Landing. And one of our first patients was an Afghani patient. And now half of our patients that come to that clinic, because it's very low price, are Afghani. And you get to learn about, their culture and the different languages they speak, Dari, Pashto, and others that they speak. So it's a great profession, and I encourage you, to pursue it, and you can do that in other health professions as well.
One more question.
Okay, go ahead.
After a person gets interviewed, and I remember back in my days, you have to fly somewhere and spend money. Luckily, I worked in college and I was able to fly a few places. But I remember you would be interviewed by several people, and then later on in February or March, you get that letter. But now I understand some schools do a one-person video interview. Is that just as good as getting all the information needed for the candidate? If you're only being interviewed by one person over the camera, how does that differ from the old days when you go from room to room and be interviewed by 3 or 5 people who then discuss you at a committee?
I have no idea about that. UC Davis uses the MMI process, so and it's done via Zoom.
Yeah, it was one of the driving forces to work moving towards MMIs. Was that, let's take the example of one of our interviewers was from rural Nevada, and maybe he had an interview with someone who came from a rural community. There's some bias that comes into that, and there's some immediate rapport that's built between the interviewer and the student that may translate to a more favorable score on their interview. So the MMIs were introduced at a time in order to introduce more voices into the conversation, rubrics that were looking at particular competencies. But there are some values to traditional interviews as well. And so some schools are now moving towards a hybrid approach. I think it's true in all of higher education. We're always looking for ways to improve the process, but we also have to sometimes deal with unforeseen circumstances like a pandemic that then move us in a different direction. We end up finding the value of being able to offer an interview experience that doesn't require that huge expenditure. That often disadvantages those that come from lower income backgrounds who we know are already in a situation that makes admission to medical school more challenging. So yeah, the process is always evolving. We're always keeping things in mind, like bias, like can we, make this a more uniform system? Can we acknowledge that there are some sections of the MCAT that might be more difficult for someone who's not a native English speaker and take that into consideration? But in the end, interviews are one part of a much larger application. And we really train our reviewers to understand the benefits that come from that application. And kind of piggybacking on Juan's question about research, it's not about what you do, but what you get out of what you do. And so what we want to know is that you have knowledge. You have knowledge of the scientific inquiry. Well, a great way to do that is to do research. We know that you understand where that is. We want to know that you have quantitative skills, that you know how to use evidence to look at the results of your inputs and your outputs. So research, again, is a great way to get quantitative experience. We want to know you have critical thinking skills. And so that's a way to show that is by research. But we also want to know you have attributes like being able to work with a team and being able to collaborate and being able to see bias in a circumstance. So by doing research, you might get all those knowledge and those skills and those attributes. But there are other things you can do to become a good problem solver, to develop quantitative reasoning skills, to become a good writer. And so the importance is that you demonstrate those things within your application. And sometimes as an undergraduate student, research is a great way to get that. But we have non-traditional students who've been in the workforce, problem solving and using quantitative skills. And so maybe they can demonstrate it otherwise. Or maybe you've been a leader in a student organization and you can show how you use surveys and evaluation and statistics in order to make better decisions. So what you want to be thinking about is how do I demonstrate that I am ready for what medical school is going to require of me? And sometimes research is the place to do it. But for you, maybe that wasn't your road, but you still want to demonstrate, hey, I took the courses, I get scientific inquiry, I did this research project in a class, and it helped me understand the importance of these things. In the end, if you can show us that knowledge and that skill and those attributes that we're looking for, then we're going to know that you are ready to be a successful medical student.
Sure, and the thing about the research or other activities that you do is, again, that gives you an opportunity besides in school where you're sitting in a classroom and a professor sees you there, every class day, but you're working with a PI or a graduate student, and they can comment on your abilities, and that's going to be factored into the admissions process. So that may help you as well from those areas. Or if you work as a scribe in an emergency room and the ER docs say that you're fabulous and you've done all these wonderful things, those are again ways that you can get your letter of recommendation beyond the experience that you get there, but that the letter of recommendation, which is a part of the application process as well. We'll say that.
But for next year, we're going to talk about applications to residency.
So, well, it's going to take them a while to get there.
But I know. But it's so, and that kind of feeds into. So there are many pieces of the pie here. Yes. And there are different ways that people appreciate the pie, and that people can put together the pie. But understanding that there is a pie to begin with, and that there is a structure that most places follow, and that most places can go through. Understanding what that structure is, and then recognizing what you're doing to be able to adapt to that structure might be the really big teaching point there. Rolling applications or not rolling applications, that's part of the structure. If you have understanding that you have a clinical experience, patient encounters, something that is yours, your own, that is part of the structure, but many people don't have. Okay, all of those things are going to be. There is a flexibility to all of this that allows for you to be able to recognize what is being asked of you, okay, and how to be able to meet that ask, but also for you to be able to put enough of yourself in that application. Okay, there is a limit, a number limit, absolutely, and that's going to be the case for no matter what, where, and how you end up going through your medical career, you're going to see that there is always going to be a specific amount of people that are going to be allowed into medical school, into residency, into a specific job, okay? But being able to utilize, understand the structure first, and then seeing how your activities fit that is important. Process improvement. So you were mentioning about research. Okay, so how about we don't have publications, but we have a really good history of being able to create a process that improved efficiency within the scribe. I created a pathway that allowed for me to be able to scribe in 2 minutes less than the other person. So even things like that are going to still be valuable experiences that you can still adapt to be able to fit that pie and to be able to fit that application. So everything, of course, you have, it's better if it's going to work so long as you have something to support it. Absolutely. But things don't but know about the structure rather than about the fact that you need to meet a need. Because you probably are already doing some of these activities as part of your career that you can utilize to be able to get to that point.
Kind of taking it a step beyond checking the box that said I did research to being able to show what you learned from that, the skills you developed, the knowledge you have, the attributes that you now can demonstrate and apply to medicine.
So I'll say a personal story. I'm foreign. I did medical school outside. I came here for residency. I go to my first time to my residency interview in person. I fly in. I don't remember where it was. I sit down and I have this attending, and he starts asking me an interview. We had also like multiple interviews, and then he does me, okay, so what's your 5-year plan? Work. So I wasn't aware of the structure. Okay, I didn't know what that included, and that was a mistake on my part. Okay, of course, once I understood the structure and knew where the resources were, that ended up floating a lot better. But going through and seeing what the structure is going to be key, no matter at which level of your medical career you are. Going into medical school, not even
Just wanted to comment on what Dr. Kukalan said is that there's a key word there that can help you, and it's called networking. It's so important because you may not find everything on Reddit, but if you're applying to a residency and you talk to other residents, maybe in PGY 2 or 3, about their experience, that's how you can get that information. And similarly, right now you're here, there's a number of physicians in this room, and you're sitting there in the back row thinking, oh, well, they're so important, I'm not going to ask them the question that I have in my head. No, why did we come here? We took time out of our day to come here to speak, and I can't think of anything more important to me when I'm talking to a student, a pre-med student, than talking to that pre-med student. That's what's most important to me at that time. So if you don't ask any questions, it's on you. I mean, sometimes I'll grab people and say, okay, what's your plan? Not your 5-year plan, but what's your plan? But it shouldn't depend on me, because we're distracted, we're doing other things. So you should come up and ask the questions. We're going to have lunch pretty soon. Mm-hmm. Yeah, and so that's your opportunity to speak to the dean of a medical school. When have you had that opportunity? Never. So here it is. I'm sorry about that, Dr. Greer.
I have to lose weight anyway.
All right. I think that's it for me. I don't want to hold up lunch.